Hello and welcome back. So, this is part 2 of our lecture on abnormal vaginal discharge. So, whenever we are taking history from a patient who presents with vaginal discharge, we have to ask about, there is a certain checklist. Okay. So, first is, yeah, color is important. What color it is? Does it cause itching? Okay. Is it associated with any urinary problems like frequency? Okay. And so, because if it is white, then it may be fungal. Okay, so you can ask, is it curd like? Okay, or yogurt like? Mucoid means mucus like, right? It's usually because of cervical erosion. Then purulent means pus like, so it may be because of an infection. Offensive means smells bad. That may be because of this related scenario, right? It may be a retained foreign body, like we said, it can be a swab, especially after stitching of episiotomy or a perineal tear, or it can be pyometra. Pyometra means pus collection in the uterus. Okay. And then there can be serous. Serous means watery. In early malignancy, it can be serous, but later on, it can become blood stained as well. In case of malignancy. Okay, and we said that especially with endometrial cancer, one of the presenting complaints may be abnormal vaginal discharge. Now, itching is important because in itching, the most common cause is a fungal infection. Okay, and if and the second less common infection is trichomonas vaginalis. Okay, so it can be a trichomonas vaginalis, which is a sexually transmitted infection, which is less common, but always think about fungal infection. And sometimes women do not know that they have diabetes. They may present with an abnormal vaginal discharge with itching, and if you, especially if it is recurrent, you can investigate, and they may be diabetic. Okay, and then dysuria, so related urinary tract infections, especially with chlamydia and gonorrhea. Okay, and if there is a recent history of miscarriage or delivery, always think about retained products of conception. Okay, like puerperal sepsis. So we always have to think about that. One more thing which is missing here is, does it smell bad? Okay, so foul smelling, like fish like odor, especially that's because of bacterial vaginosis. Now we will talk about bacterial vaginosis, which is one of the very common conditions, but it is very clinically important, especially in pregnant women. Okay, also in non-pregnant women, but especially in pregnant women. So it is the commonest cause of abnormal vaginal discharge. It is not a sexually transmitted infection. Okay, so why it is important to know which one is sexually transmitted and which one is not? Because if an infection is sexually transmitted, then we need to screen their current and recent partners. We need to simultaneously treat them, okay, at the same time, and then we have to check for other presence of other sexually transmitted infections as well. Okay, so a bacterial vaginosis, it is said that it can also be present in even like homosexual women. So it's not a sexually transmitted infection. It can be even present in very young girls who have never been sexually active. So why does it happen? See, in the vagina there are normal microorganisms, right? There is normal flora, but if there is depletion of that normal flora, which are the lactobacilli, then the bad ones, they outgrow them. So this is just the imbalance between the good microbacteria or the flora and the bad one. That's it basically. Okay, so characteristically, the characteristic feature is it does not cause itching, but it causes a bad smell, which is characteristically called a fishy odor. Okay, like fish like. And if we take a sample of the vaginal discharge by a high vaginal swab, which we discussed on one of our clinical sessions, and then if we send it to the laboratory, they can check the pH, and then they know that the pH is increased in vagina, which is more basic, right? The normal pH of vagina is more acidic. Okay, so it will change, it become more basic. Okay, we said that it's not an STI, so it is not needed to treat current or recent partners. It does not cause itching. What are the possible complications? It can become pelvic inflammatory disease. So what do we mean by that? So from vagina, it can ascend to the uterine cavity, and it can spread even to the fallopian tubes and the rest of the pelvis, because fallopian tubes are open, right, at the end. They are not blocked. So if there is an infection, if there is pus, for example, or any infection, even in the absence of like gross pus, then they can enter the pelvis. Okay, which is called pelvic inflammatory disease. Especially in pregnancy, bacterial vaginosis can lead to PPROM and preterm labor. Okay, so they can cause weakening of the membranes, amniotic and chorionic membranes, and they can cause a PPROM. Okay, so that's why in pregnancy it's very important. Then sometimes what happens, if at the time of hysterectomy a woman had bacterial vaginosis in vagina, but if it was not detected and if it was not treated and hysterectomy was performed at the same time when the bacterial vaginosis infection was present, later on, because the vagina is left intact, right, cervix is removed, so it can infect the vaginal cuff and it can cause cellulitis. So it can also cause miscarriage. Okay, although and then we discussed about prom, p-prom, increased risk of HIV. Yeah, so this is important. If a woman having bacterial vaginosis is exposed to HIV, okay, she is at more risk of acquiring HIV. Okay. Now, how do we diagnose it? Okay, so if a woman presents with any vaginal discharge, we have to perform a speculum examination. Even if she's pregnant, it is safe. And then what do? We take a high vaginal swab, okay, and then just send it to the laboratory. And of course, you notice how does it look like. So in bacterial vaginosis, it's mainly, it may be grayish, it may be homogeneous when you are doing it. It may look like, it may smell bad. Even on examination, you can smell it. Okay. So now when you send it to the laboratory, they perform a few tests. Okay, and there are different criteria which are used. The most famous one, especially which one is written in the 10 teachers, is Amsel criteria. It's one of the famous ones, and usually it is asked in the exam. In the UAE, usually this Nugent criteria is used. Okay, and then there is another one which is called Hayisen. Now we will describe Amsel criteria. Amsel criteria means out of these four parameters, if any three are present, that means it's bacterial vaginosis. Okay, first is a homogeneous discharge. So when we are examining the patient, we notice that it's a homogeneous discharge. Okay, usually it's grayish in color, or and homogeneous means smooth. Okay, and then high pH, as I said, so the pH now becomes more basic instead of acidic. Then there are, when they perform microscopy in the laboratory, they see some cells which are called clue cells. I'll show you in the next slide. These are actually vaginal cells, but their margins are not clear because of heavy deposition of bacteria. Okay, so they are called clue cells. So how do we know that? When they send a report, they write spatially, clue cell is this, clue cells are present. They spatially tell us. Okay, and then in the laboratory, to the vaginal discharge, the sample which we had sent, if they add 10% potassium hydroxide, it releases a fishy odor. Okay, so any three. So first is, that's a homogeneous discharge. Second is when they check the pH, it will be more basic. Third is they see clue cells. This is a clue cell actually. So clue cells are actually vaginal cells, and but the margins are not clear. Margins are obliterated because of heavy deposition of bacteria. Okay, and the last one is if they add potassium hydroxide, it releases a fishy odor. Okay. Now, what is the treatment? So, treatment is, we have, if it's a simple like bacterial vaginosis and not causing PID, right? So, we have options of giving either vaginal metronidazole, intravaginal, or oral metronidazole. Okay. Usually, vaginal metronidazole is more preferred, and vaginal metronidazole comes as either tablets or creams. In the UAE, we usually have tablets. Okay, and if, say for example, if someone is allergic to or resistant to metronidazole, we can give them intravaginal clindamycin. Okay, again, it can come as creams, intravaginal creams, or it can come as intravaginal tablets. Now, if a woman does not want to have intravaginal preparation, like if a woman is it's a young girl and she is not sexually active in the UAE, then we have to give them oral metronidazole. Okay, oral metronidazole is the problem with oral metronidazole, especially, we have to make sure that the woman does not drink alcohol at the same time. Otherwise, she can have a severe reaction, which is called disulfiram reaction, right? Which can be even a life-threatening situation. So, women, in any case, any person who is prescribed oral metronidazole, they should not take alcohol at the while taking the medicine, or even 48 hours after the last dose. Okay, so this says avoid vaginal douching or excessive vaginal washing. Vaginal douching means do not apply antiseptics to vagina, especially from inside. Okay, because it kills the good bacteria as well. Women do not realize that. A lot of women do it. They think that they are cleansing themselves. It's not. Now, with the preparation, usually, so what happens is, usually it comes with an applicator, and with this applicator, so the tablet or the vaginal cream, this is placed here, and then it is kind of like a syringe, and it is pushed inside the vagina, and it should be placed deep inside vagina. Usually it is given at the bedtime, so that the tablet does not fall out, and it is usually once a day. Okay, vaginal applicators are used to apply intravaginal cream or pessary. Okay, so I'll stop here, and the next one we will do in the next part.